Migraine is a prevalent neurological disease affecting 39 million men, women, and children in the United States. And here's an astounding number: 1 billion people worldwide. Migraine is the third most common illness in the world, with approximately 12% of the population suffering from migraines. Migraine, defined as a painful neurological disease with extremely incapacitating neurological symptoms lasting 4 to 72 hours, is much more than a headache. Over 90% of migraine sufferers are unable to work or function normally during an attack. Recently, there have been some exciting advances in the diagnosis and treatment of migraine. AJMC Peer Exchange with our panel of experts is going to discuss the optimal management of migraine, including the role for newer, more specific therapeutic options. Stay with us. I'm Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University College of Physicians and Surgeons and associate director of surgical intensive care at New York Presbyterian Hospital. Joining our distinguished panel to share their perspectives are Ms. Jill DeLynn, a registered nurse and certified health education specialist and patient advocate; Dr. Peter Goadsby, director of the NIHR Wellcome Trust King's Clinical Research Facility and professor of neurology at King's College London and University of California, San Francisco; and Dr. Malika Stoll, senior medical director at Blue Shield of California. All of you, thank you so much for joining us. Why don't we just dive right in? I think we ought to get going by defining some terms. What is a migraine?
A migraine is an episodic disease of the brain that involves dysfunction fundamentally in sensory pathways. So it involves pain, it involves sensitivity to light, sensitivity to sound. For 2/3 of patients, sensitivity to light, to just touching the head. Migraine is a pan-sensory disturbance, if I could put it that way.
Sounds dreadful.
It is dreadful.
And just for the sake of completeness, how does a visual migraine differ from that? That just visual disturbances without the other epiphenomena?
About 25% of migraine sufferers have aura, visual. It's typically visual. 90% of it is visual aura, and that usually involves little jagged white lines that start in one part of the vision and then will expand, leaving a loss behind it, a so-called scotoma or black spot, and then over about 30 to 60 minutes completely dissipate. And that's the typical visual aura.